One of the big things that I do like to kind of caveat with zinc supplementation is, to always work with your doctor or a registered dietitian on how much you should consume daily, like we talked about. It kind of fluctuates throughout the life cycle. But basically the digestion and absorption of zinc can interfere with the digestion and absorption of both iron and copper. So fortunately, foods that are high in iron or fortified with iron, we don't see any kind of impact on the absorption of zinc, but sometimes iron supplementations can block that absorption of zinc, which is why we recommend taking those iron supplements between meals on an empty stomach. But also high zinc can lead to a copper deficiency, because basically those two minerals are absorbed in very similar ways. So sometimes when we give a super dose of zinc, we can start to see a copper deficiency. So interestingly enough, at the beginning of the COVID pandemic, we saw a lot of copper deficiency because people were, taking a lot of zinc, and it was minimizing their copper absorption. So kind of in some of what you were discussing, copper deficiency can lead to issues with the connective tissue, muscle weakness. It can even lead to anemia, low white blood cells. So that, wouldn't really help our immune system very much. Neurological problems, and sometimes paleness, which I always think is an interesting one. That might be one that we would see before we would notice with some things going on inside of the body. So again, I think it's always important to kind of consider all of these things when we're adding in supplements and making sure, you're working with a professional to get the right regimen with food and supplements if necessary.